Good morning, class. This is a PowerPoint presentation by Ajoya and Lana Watson, and today we will be talking to you about antifreeze. What is antifreeze? Antifreeze is made up of ethyl glycol, fungicides, rust inhibitors, pH value regulators, and pour point depressants. Ethylene glycol, one type of antifreeze, is a colorless, odorless substance with a molecular weight of 62.07 that is highly toxic. Ethyl glycol has a freezing point and boiling point of negative 13 degrees Celsius and 197.6 degrees Celsius, respectively. Antifreeze has low viscosity and electrical conductivity and is non-corrosive and transfers heat well. On the right, we can see a picture of ethyl glycol and its colorless and odorless appearance. So, what are some sources of exposure to antifreeze that maybe you didn't know about? Industrial coolants, like the coolants you put in your engine in the winter so that it doesn't freeze up, is one of them. Air conditioning systems is another. Skating rinks, ballpoint pens, daily things that we use, eye masks, some latex paints. All of these are sources of antifreeze that maybe some of us didn't know about. So, what are some symptoms of antifreeze poisoning? Loss of balance, like dizziness, vomiting, depression, thirst, increased urination, or even seizures. Of ethyl alcohol or foampizo to prevent more metabolism of ethyl glycol is the first step. Hemodialysis to remove ethyl glycol from the bloodstream is the second step. Administration of sodium bicarbonate and dialysis to correct metabolic acidosis is the third step. Correction of hypocalcemia being an abnormal calcium level is the fourth step. Cofactor therapy to eliminate toxic metabolites of ethylene glycol is the fifth step, and constant management of fluids, ventilation, and therapy for acute renal failure is the fifth and final step. There are several prolonged exposure symptoms to antifreeze: severe metabolic acidosis, renal dysfunction, hyperkalemia, cerebral and meningoencephalitis, pulmonary edema, pneumatosis, and eventual death. Okay, class, pop quiz. A 27-year-old male is found in a motel room after telling an acquaintance that he was going to drink antifreeze. In the motel room is a glass with what looks like antifreeze. The patient says it is and says that he drank one glass. He is brought to an ED in police custody. They're anxious to take him to jail. In the ED, he is alert and cooperative, oriented to person, place, and time. PMH reveals multiple prior suicide attempts. Physical examination is unremarkable. He has multiple old scars from apparent self-harm efforts. Urine tox screen is negative for drugs of abuse. Urine shows no crystals. Blood ethylene glycol level measurements will not be available for more than 24 hours. The hospital cannot do a measured serum osmolality on site. An EG sample is sent out. In the absence of a stat EG level or a serum osmolality, the physician caring for the patient elects to follow serum bicarbonate level as a possible marker of severity of ethylene glycol poisoning. His logic is that since EG causes over time a profound metabolic acidosis, the absence of an acidosis over time would be presumptive evidence that no significant ingestion had occurred. The following laboratory values were obtained. Take a moment to read the sample on the screen. By morning, no metabolic acidosis has developed and serum bicarbonate has actually risen. The ethylene glycol level is not back. The patient does not look sick and is released in the custody of police. Within 24 hours, the patient becomes acutely ill while in jail. He arrives back at the hospital profoundly acidotic and hypocalcemic. He suffers a cardiac arrest and cannot be resuscitated. After the patient died, the lab reports that the patient had a highly toxic ethylene glycol level drawn on the first visit. Take a moment to answer the questions passed out. Thank you. There is a very specific toxicant pathway that antifreeze takes once ingested. Intoxication due to ethylene glycol is in many cases due to intentional ingestion of the substance. Mortality rates range between 1 and 22% depending on how much was ingested and the time taken to receive treatment. Poisoning due to ethylene glycol accumulates in the form of glycolic acid and oxalic acid, making it very dangerous. Metabolic acidosis is caused by the accumulation of glycolic and lactic acid. Ethylene glycol is poorly absorbed by dermal and pulmonary routes, but is readily absorbed from the gastrointestinal tract. Peak serum ethylene glycol concentration occurs 1 to 4 hours after ingestion. Ethylene glycol is not protein bound, and because it is highly water soluble, distributes evenly throughout body tissue with a volume of distribution of 0.5 to 0.8 liters per kilogram. The stepwise hepatic metabolism of ethylene glycol proceeds in a nicotinamide adenine dinucleotide dependent fashion. The first step is oxidation of glycoaldehyde by alcohol dehydrogenase. Subsequently, glycoaldehyde is oxidized to glycolic acid, to glycosilic acid, and finally to oxalic acid. Because the conversion of glycolic to glycosilic acid is the rate-limiting step in this process, the accumulation of a glycolic acid is largely responsible for the metabolic acidosis seen in this poisoning. Approximately 80% of an absorbed dose of ethyl glycol is hepatically metabolized, with the remaining renally excreted unchanged. Now my partner Lana will come and talk to you about a few things that she found. Thank you.